Do you lay awake at night Googling, is my child's food reaction dangerous? Or is this the tummy ache that's going to land you into the emergency room? Or are you avoiding an entire section in the grocery store, unsure of what foods are going to make your child uncomfortable rather than dangerous? Hi, my name is Dr. Mireku, board certified allergist, mother of 2 kiddos with food allergies, and I am on a mission to educate you, empower you, so that you can live a life of freedom instead of restriction. In this video, I am going to provide clarity on what is a food allergy versus what is a food intolerance. I'm going to include the top questions that I get asked in my clinic every single day. So what is a food allergy versus food intolerance? Let me break this down using some examples of patients I saw in clinic last month. Maya is a 5-year-old who, every time she had milk, started to develop hives around her mouth and lip swelling, and even one time had trouble breathing. This is completely representative of a food allergy. See, her immune system views milk protein as an invader. Milk protein is harmless, but her immune system views it as an invader and therefore mounts an immune attack, releasing histamine, releasing leukotrienes, and other mediators that lead to coughing, wheezing, swelling, and hives. On the other hand, let's discuss Alex. He's a 9-year-old who also had trouble with milk, but his symptoms did not occur until 8 hours after drinking milk. His symptoms were representative of tummy ache, bloating, gas, diarrhea, obviously very uncomfortable, but not life-threatening. See, with Maya, she had a food allergy to milk. Her symptoms were immediate and were immune-mediated. With Alex, symptoms did not occur till about 8 hours later, more representative of a food intolerance. In food intolerance, especially milk intolerance, the issue is the lactase enzyme, which is unable to digest the sugar lactose, thereby leading to symptoms of tummy ache and pain. Research has shown that there are about 8% of kiddos with food allergies and about 20% of us, children and adults, that suffer from food intolerances. Are food intolerances dangerous or just uncomfortable? They're not dangerous, but they are uncomfortable. Oftentimes, patients are complaining of bloating, gas, diarrhea, and it just affects your overall quality of life. What I worry about the most is your nutrition, because you're avoiding all of these different foods, and oftentimes your nutrition can suffer. In our clinic, we work together with a registered dietitian to optimize your nutrition. On the other hand, food allergies can be dangerous and can lead to allergic reactions. And so we always recommend that you carry your epinephrine autoinjector with you at all times. So how do you know if your child's reactions and symptoms are serious? Here's what we do know. Every 3 minutes, a child or an adult is rushed to the emergency room for an allergic reaction. Let's discuss this. If your child is having coughing, wheezing, hives, vomiting, diarrhea immediately after the offending food, and when I mean 2 minutes to 6 hours after, it's likely an allergic reaction. Whereas if they're having tummy pain, diarrhea, bloating, or gas 8 to 12 hours after, it leans more to a food intolerance. Remember, all of this decision-making and discussion should be with your local board-certified allergist. Here's what I tell my patients. If you feel that your child is having a reaction, you know your kid, use that EpiPen, and if there's no improvement, report directly to the emergency room and contact your allergist. Can a food intolerance turn into a food allergy? This is a common question that I get in my clinic, and I get it. The good news is the answer is no. There are 2 different biological processes. For example, in a milk protein allergy, the issue is an immune mediated reaction where the body views the milk protein as harmful. And in a milk intolerance example, the issue is there's an enzyme deficiency which is unable to digest the sugar. Two different processes. However, you can have a milk intolerance, for example, and a milk allergy in the same individual. So what are the best tests to differentiate between a food allergy and food intolerance? This is a common question that I get in my clinic. For food allergies, your allergist is really going to focus on the initial history. They're going to look at the timing and onset of symptoms, whether you have other allergic conditions, and then they'll follow up with IgE-mediated tests, such as skin testing and blood work. In addition, some of us are using basal activation testing, and of course, the gold standard, a food challenge, in order to differentiate if you have a food allergy. When it comes to food intolerances, oftentimes the history is very important again. We're also going to use food diaries, and oftentimes we do elimination diets in order to figure out what is the trigger food. Can food allergies and food intolerances be treated? This is where it gets to be so much fun. I have been treating food allergies for over 10 years. We have seen children who have been fearful and avoiding foods and make transformative change where they can currently eat those foods and have freedom through treatments such as oral immunotherapy. We've also been able to treat and create change through food sublingual immunotherapy, where we can increase their threshold so they're less likely to have an allergic reaction. There are biologics available and so many different options for your kiddo. In addition, for food intolerances, we work on identifying what are the triggers, what is the enzyme deficiency, what are the types of diets that we need to improve their life, and really collaborating with a registered dietitian to improve nutrition and overall quality of life. So can you outgrow your food allergies and intolerances? This is where it gets a little bit fun. Research shows that 80% of kiddos are able to outgrow their milk, egg, wheat, soy allergy, and 20% can outgrow their peanuts, tree nuts, fish, and shellfish. Food intolerances, they're often lifelong, but what's beautiful about them is that there's usually a threshold level. So maybe you can't have a full glass of milk, but you can have a little bit of cheese on your pasta in the milk example. So if you, your kiddo, or any family member is suffering with food allergies and you live in the DFW, Texas area, and you want to explore what is possible besides avoiding foods, reach out to us. That is what we specialize in at TexasAllerg MD Safe to Bite Food Allergy Center. Next week, I'm going to be discussing the common food allergy myths. One might shock you, so make sure you subscribe so you don't miss it.